The Omicron hotspot has seen an explosion of cases in the past few weeks, and the spike in infections has spread across the country. However, early studies point towards some positive developments. The research into the early experience of the patient profile, which was done at Steve Biko Tshwane District Hospital Complex in Pretoria, has been published by the SA Medical Research Council. As cases start to climb, COVID-19 death rates also creep upwards. That has not been reported with Omicron infections at this stage. However, it does break an established pattern that is seen in our previous 3 virus waves. So what are the 5 encouraging signs that are coming from South Africa's Omicron hotspot? Well, the hospitalized in Omicron wave are less dependent on ventilation. Yep, more cases do lead to more hospitalization, but the Omicron positive appear to be less reliant on ventilation aids. Child admissions are up, but death rates have flatlined. It is reported that more kids are in the hospital than usual due to the Omicron virus, but mortality figures are favorable. There were no COVID-related deaths among 34 admissions in the pediatric COVID wards over the last 2 weeks. This compares favorably to the proportions of death at the complex over the past 18 months. Most COVID-positive patients were not even admitted because of the virus. That's right, according to data, a majority of patients in this cluster didn't come to the hospital because of COVID. That's a very good sign. This means the first impression of examination of the 166 patients admitted to Steve Biko is that the majority of the hospital admissions are for diagnosis unrelated to COVID-19. Omicron is now presenting a very different picture compared to all 3 previous waves. Comparatively speaking, hospitalizations and deaths are low. The relatively low number of COVID-19 pneumonia hospitalizations in general, high care and ICU wards constitute a very different picture. And last but not least, vaccinated elders are less likely to be hospitalized than unvaccinated young adults. The jab effect is in full swing, with younger patients, mostly unvaccinated, occupying more beds than older patients who are mostly vaccinated. This is some really good news considering that Omicron was first portrayed as the worst possible variant. This may now be counterclaimed by facts, as the research conducted in Tshwane is giving us more promising news from local hospitals. Let us know what you think on the comments down below. Lisa Grayson, The South African.